Understanding cyanide poisoning, causes, symptoms, and emergency treatment. Hello, everyone. Welcome back to our channel. Today, we are delving into a topic that requires our serious attention, cyanide poisoning. Also known as hydrocyanic acid or Prussic acid poisoning, it's a highly toxic substance that can have dire consequences. Stick around as we explore the mechanisms of action, symptoms, and most importantly, how to provide emergency treatment in case of exposure. Introduction. Cyanide is also known as hydrocyanic acid, Prussic acid, cyanogen. It have odor of bitter almonds. Cyanide poisoning results from exposure to a number of forms of cyanide like hydrocyanic acid, cyanide salts, cyanide gas etc. In some countries, hydrocyanic acid gas is used for legal execution. Mechanism of action. Cyanide inhibits the action of cytochrome oxidase and carbonic anhydrase. This results in histotoxic or cytotoxic anoxia. Blood has normal oxygen content but tissue unable to utilize it. This eventually leads to death of a person. The onset of symptoms with cyanide poisoning is very rapid. In fact, when cyanide gas is inhaled, the onset of symptoms is instantaneous. Mode of absorption of cyanide. Cyanide gas is absorbed through respiratory system. Hydrocyanic acid can be absorbed through stomach when ingested, and also it can be absorbed through skin when a person comes in contact with hydrocyanic acid. Cyanide salts like potassium or sodium cyanide when ingested are converted by hydrochloric acid in the gastric juice into chlorides, and hydrocyanic acid is liberated. Due to this process, symptoms take 10-20 minutes to appear when cyanide salts ingested. Symptoms of cyanide poisoning. CNS. Headache, confusion, opisthotonose, hypothermia, convulsions, paralysis, coma. GIT. Bitter, acid burning taste, constriction or numbness of throat, salivation, nausea. Respiratory system. Odor of bitter almonds in breath. Initially there will be tachypnea and dyspnea, later there will be severe respiratory depression and cyanosis. In fact, the cause of death in case of cyanide poisoning is from respiratory failure. CVS. Initially there will be hypertension with reflex bradycardia and sinus arrhythmia, later on there will be tachycardia with hypotension and cardiovascular collapse. Skin. Perspiration, bullae formation. Eyes. Appear glassy and prominent, pupils dilated, unreactive. Renal. Acidosis. Treatment of cyanide poisoning. Break 0.2 ml ampoule of amyl nitrite in a handkerchief and hold over the patient's nose for 15 to 30 seconds of every minute. Then 0.3 grams of sodium nitrite in 10 ml of sterile water is given IV slowly over a period of 1 to 3 minutes. Sodium nitrite forms methemoglobin. This methemoglobin binds cyanide and result in formation of Cyanmethemoglobin. This prevents the binding of free cyanide to cytochrome oxidase and prevents the toxic effects of cyanide. Following this, 25 grams sodium thiosulphate in 50% solution IV infusion over a period of 10 minutes, it converts cyanide to non-toxic thiocyanate. Repeat the nitrite thiosulphate injection after an hour if needed. Other treatment options for cyanide poisoning. Hydroxycobalamin 4 to 5 grams IV infusion is given, it forms non-toxic cyanocobalamin. Dicobolt EDTA 600 mg. IV slowly followed by 300 mg if recovery does not occur, acts by chelating cyanide, more rapid in action, efficacious and less toxic than nitrites. Gastric lavage is then performed using activated charcoal, 10% sodium thiosulphate, potassium permanganate. It is important to ventilate the patient with 100% oxygen to prevent the respiratory depression. Whenever the percentage of methemoglobin is more than 50%, we need to do exchange transfusion. Postmortem appearances of cyanide poisoning. Eyes are glistening and prominent with dilated pupils. Jaws are firmly closed, froth at the mouth. Cheeks and post-mortem staining will be cherry red or brick red. Blood is bright cherry red. Veins contain oxygenated blood in case of cyanide poisoning. Odor of hydrocyanic acid on opening the body. Congestion of viscera and edema of lungs. Cyanide salts also causes corrosion of mouth. Well, there you have it, a comprehensive overview of cyanide poisoning, from its mechanisms to its symptoms and, most importantly, the steps you can take to provide emergency treatment. Remember, in cases of suspected poisoning, always seek immediate medical assistance. If you found this video informative, don't forget to hit that like button and share it with your friends. Subscribe to our channel for more essential insights into medical and scientific topics. Stay safe, everyone, and until next time, take care.